Welcome back to Daniyal Ultrasound Clinic, Dr. Munir Basi. We have got a patient. He is aged patient and giving history of menopause for 10 years. But later she started having pussy discharge from vagina and pain in the loins and uterine area. Now let's see what shows up. This is urinary bladder as usual, filled, adequately filled. This is uterus, longitudinal section. Here the most important thing to note here is this is the uterine cavity. Here this is uterine cavity, this is uterine outline, this is cervix, this is vaginal area. So fundal part of uterine cavity is showing anechoic fluid collection. The fluid shows few echoes, however. The uterine cavity here is irregular slightly. No definite evidence of solid mass or septation seen. Only the fluid is visualized here. This is the transverse section. You see, this is the transverse section of uterus, showing again same fluid. This is longitudinal section. So now, what does this mention? What does this show? Whether there are echoes, septations, or debris inside the fluid. Debris could be due to blood, pus, or any other products, but there is no such evidence. So now possible causes we have to take under consideration. What are the possible causes? Could be physiological or benign, like normal menstrual phase, but this is an aged patient, developed symptoms after prolonged menopause. So physiological or like a normal menstrual phase or ovulation process, or could be post-procedural, like post-delivery or post-delivery changes, where we can see the lochia retained in the cavity, but there is no such history. The second most prominent is gynecological or pathological causes like endometritis, like inflammatory, but that may have echoes. Here are less echoes, not prominent one. So could it be a hematometra, like blood due to outflow obstruction or cervical stenosis, congenital anomaly, and endometrial pathology could also be due to development of polyps, CA, or secondary cavity fluid. The other cause may be post-abortal, but this is the aged patient again, I tell you. So third most important cause is the post-treatment or post-surgical. That is after DNC, dilatation and curettage, or intrauterine devices, they also produce such kind of complications like retained fluids. So the DD, now let's go to the DD. It could be physiological endometrial cavity fluid, could be endometritis or Pyometra, could be Hematometra, could be Hydrometra, could be due to malignancy, because there's a retained fluid in malignancies also. So this is all, and we have another additional finding here. This is the right ovarian simple cyst, which measures approximately 3.0 centimeters, but this is less important. The most important thing here is to note is the cavity fluid, uterine cavity fluid, which is retained in the fundal area of the uterine cavity. The possible DDs and causes I just mentioned you. And one more thing to be noted here is that patient is aged patient. And after 10 years of menopause, she developed pussy discharge from the vagina. So this is all, guys. Thank you very much.